This is video 7 of the endocrine system, and today we are going to talk about the pituitary gland. The pituitary gland also has another name. It is sometimes called the hypophysis. And here we can see that we have a picture of a person with a sagittal cut in their brain. Here it's blown up. And here is the cerebrum, here's the cerebellum. Down here would be the medulla oblongata and the brainstem. This area right here is called the hypothalamus. And it contains neurons that are going to talk to the pituitary gland. The pituitary gland is right here. It's a little bit hard to see in here, but if we circle that, that is the pituitary gland. It's about the size of a pea, so it's really small, but is very, very powerful. Right here is a stalk, and it has a hard name. It's called the infundibulum. And we have two parts of the pituitary that we'll talk about in a little bit in a lower diagram. But what's really unique about this, we can see one of the sinuses right here for this bone. This would be right up here, kind of back behind your nasal cavity, and that's how they access things. So there's a sinus here, so this is actually pretty thin bone. That's how they access the pituitary if there's a problem. But right up here, right by the infundibulum, is the optic chiasm. So if you remember, that is where the optic nerves, as they're coming from the eyes, cross. And there's a lot of things going on right in this part of the brain, but it's right in the middle of your head, so it's fairly well protected. So this pituitary gland, and we're going to talk about it a little bit, is about 1 centimeter in diameter. So it's really small. And there are 9 hormones that are secreted by the pituitary. And we are going to move to the note packet to talk a little bit more about the hypothalamus and the two parts of the pituitary gland before we return back to this diagram. So if you can turn to page 3 of your note packet, you can see that here it says pituitary gland, see figure 8, that's where we just were. So the hypothalamus is part of the brain. That secretes hormones. And these hormones that are produced there can be one of 2 types: releasing hormones and inhibiting hormones. Releasing hormones increase secretion of hormones from the pituitary. Inhibiting hormones decrease secretions. Hormones from the pituitary. And for the most part, these releasing hormones and inhibiting hormones are going to affect the anterior lobe of the pituitary. So the pituitary has 2 parts, posterior and anterior. We know those words already, so posterior is the back, anterior is the front. The posterior hormone, or posterior pituitary secrete, is also called the hypophysis, and it secretes two hormones. And this one is not under what we're going to call the hypothalamo-hypophyseal portal system. This one does not work with releasing hormones and inhibiting hormones. This is based on nervous stimulation. The anterior pituitary is called the adenohypophysis. I prefer anterior pituitary, it's a lot easier to say. And we are going to have 7 hormones that can be secreted by the anterior pituitary. And this is under hypothalamus hormone secretion. So the hypothalamus releases hormones that will stimulate or inhibit the anterior pituitary. And an example of this would be the hypothalamus can secrete growth hormone releasing hormone, and that is going to cause the anterior pituitary to release growth hormone to the body. So the hypothalamus sends signals either through hormones or through the nervous system, and that can inhibit or stimulate hormone secretion by the pituitary. And then we have this infundibulum. This is just the pituitary stuff. So we're going to switch back to our diagram packet and finish this one off. So here is a bigger diagram of what the pituitary looks like. These right here are hypothalamic neurons. Then you can see that this network of blood vessels is only present here in the anterior pituitary. And this set of blood vessels has one of the longest names that we're going to see in all of anatomy and physiology. It's called the hypothalamo-hypophyseal portal system. So this is a circulatory system, blood vessels. So if you want to put that there, blood vessels. So that's how it relies on talking to the hypothalamus, is through blood vessels. The anterior pituitary is a hypothalamo-hypophyseal portal system. On this side, you can see that we have these direct pathways from the hypothalamus, from the neurons that come down in here. This is called the hypothalamo-hypophyseal tract. And this is the nervous tissue or nervous system. So that's what we have for this diagram. Now you'll notice a lot of things surrounding here. So this represents all the different target instruments for these. So we're going to label these A, B, and these are the only two that are posterior. So this is the posterior. And then here we have C, D, E, F, G, H, and I. And we're going to refer to these. We can see that A, we have a kidney, B, we have the uterus and a breast, C, we have a breast, D, we have the skin, E is an ovary, F is a testicle, G is the thyroid, H is the adrenal, and I are bones. So these are going to be target tissues for all of these things. And we're going to explain in the next video what all these different hormones are. Thank you.